Every year on 8th of September, we are observing World Physiotherapy Day. Physiotherapy is a profession that diagnoses and treats pain and other movement related disorders by exercises and other physical means. I am Raj Kannan, physiotherapist, and on behalf of Chandai Rheumatology Hospital chronic pain team, I am here to deliver the World Physiotherapy Day message to the general public. In this current urbanized world, 1 in every 5 individuals are suffering from either neck pain or back pain or shoulder pain or arthritis or other chronic pain syndromes. This pain and dysfunction is a huge burden to the society and it costs billions of dollars to the country. Though every pain and movement disorder must be treated correctly after a specific diagnosis, I am here to tell few tips about how to lead your life so that you can stay pain-free and healthy. Except for the fracture, injury, infection or tumor related pains, most of the current pain is due to the lifestyle factors, and we all know that how bad we are in our lifestyle currently, especially with our digitalizations and technological advancements. Our physical activity have come really standstill, and we human beings are moving so much less nowadays, and human beings have been sitting more number of hours than ever in the history of humankind, and that is more dangerous because sitting is a new form of smoking. Some of my patients who come to me for their pain, they literally sit for about 10 to 12 hours almost every day, and then they come to me and asking for pain relief. We human beings are designed to move and not sit for long period of time. Our grandfather or our great grandfather never sat for 8 to 10 hours in a single place. So the first step towards your lifestyle modification is to be mobile. So try to be as dynamic and as mobile as possible. Even if you have to work for a long period of time, okay, every 2 hours once, just get up, move around, take a small walk for about 10 minutes and then you come back and sit. You can also buy a standing desk and then stand and work. As you stand, you can keep moving your legs and you can keep moving your trunk and keep moving your neck so that you keep your circulation intact. These are the ways by which you can somehow get away from the ill effects of prolonged sitting. Even when you are sitting, try to sit as erect as possible. Probably keep a lumbar support or something to maintain the arch of your back, because most of us will be comfortable in sitting in a relaxed slouch posture, which will be feeling very good for some time, but eventually that itself will be detrimental for the health of the back. That's the reason why many young population nowadays are suffering with back pain and neck pain. Ever in the history, 20 years back, this was not the case. Young people never had this kind of pain. If you are young and still if you are having pain, mostly this pain is attributable to the poor sitting posture or too much sitting duration. So fix these two things, thereby you can at least give yourself a chance to have less pain. Even children are suffering with neck pain and back pain nowadays. So I advise parents who are watching this video to have your children understand the importance of sitting straight and using the phone straight and reducing the screen time as much as possible. By sitting slouch, the spine will be aging very faster. That's why old people are like this. If you keep the spine erect, you remain young because you are as old as your spine, and your spine health is important for your organ health. Every organ gets the nerve supply from the spinal cord. The spinal cord is in the spine. When you slouch too long, too much, it may affect the nerves in the spine, which in turn have bad effects to the organs. That's one of the reasons why people nowadays are suffering from too much of gastric disorders and headache and poor digestion and PCODs and so on. So keep your spine erect and keep your spine healthy. Next, once you get the pain, you try to get the diagnosis first. Don't allow the pain to get worsen and making our job tougher, because most of the chronic pain patients who we see in our clinic were in those days were acute pains. Since these acute pains were not treated correctly or not diagnosed correctly, these patients have become a chronic pain patients, and then treating them will be very arduous task. If your pain doesn't go away in 3 days to 4 days time, or if your pain is recurrent in nature, then it's time to make a diagnosis and get the treatment to fix it once for all. And for chronic pain, there is no quick fix. Let's say you are having 10 years of back pain and 10 years of neck pain. There is no one ointment or one pill that you can pop and you will be fine once for all. It's a task. You need to get into the root cause of the chronic pain, and then we have to treat you step by step so that in a month or two you should become reasonably well. So don't get into the false treatment trap like YouTube exercises or massages and ointments, and then all these TV given ads about certain certain products which relieves your pain, the mattresses or the special orthopedic pillows, nothing of these sorts will be curing you permanently, though it will give you some comfort and some temporary relief. Those things will not give lasting recovery. So get your chronic pain diagnosed by a qualified therapist or a doctor and get yourself enrolled in a proper treatment regimen. Some people have a habit of taking medicines for every pain. There are so many over-the-counter medications available which they pop and they think they'll be all right, but the pain is a symptom, like how giddiness is a symptom, how edema is a symptom, like that pain is a symptom. So you need to go back to the cause of the pain so that the pain doesn't come back. And if you treat pain, and if that pain is mechanical in nature and lifestyle in nature, your pain will never go away. And that's one of the reasons why people become a chronic pain patients, because they wanted a quick fix by popping a pill. Especially for the mechanical and lifestyle related pains, there is no treatment until you address your mechanical component and then lifestyle component, then you probably can get the cure. Once these pains are looked after, you have to get yourself into some sort of physical activity, because we human beings are designed to move. Have some exercise regimen for yourself. At least do 2 or 3 times of endurance exercise, which involves 30 to 40 minutes of brisk walking, or if you're young you can think of jogging or maybe cycling and swimming. These are all the wonderful way of improving your cardiac fitness and then endurance and aerobic capacity, which keeps your blood vessels pliable, which will reduce your BP and risk of coronary artery disease and stroke and even diabetes. See what you like, maybe walking or running. Do it at least for 3 times in a week to keep your aerobic fitness intact. Apart from that, you have to do a little bit of strength training as well, because as you age, you lose your muscle mass, you lose your strength, and muscles will become fatty, infiltrated. Strength training in the young age will keep you in a better shape when you become old. You don't have to always go to gym for all this strength training. All you need for strength training is 1 or 2 sets of 10 repetitions of push-ups, pull-ups, lunges, squats and planks, side planks and stair climbing. These exercises are sufficient enough to maintain your muscle strength, which will be good enough to maintain your muscle mass, improves your metabolic rate, reduces your risk of diabetes, because muscles will consume glucose. So more the muscle, more glucose will be used up, so that the glucose will not stay in the blood to cause diabetes. Do this strength training at least 3 to 4 times in a week to maintain the training effect. If you want to add varieties, you can have some TheraBands like this, or you can have some weight cuff dumbbells you can use to have some added effect. Aging will be pleasant if you do strength training. Next thing I want to touch upon is eating. There is one more pandemic going on, which is overeating. Easy accessibility to the food and easy affordability to the food has made people to eat too much. You know what? 80% of our Indian diet, we consume only carbohydrates, and this carbohydrate is one of the major reasons for sickness and the childhood diabetes mellitus and childhood hypertension, and young people are dying of cardiac problem. It's all because of excessive amount of glucose in the blood, which causes metabolic syndrome. Actually, the sugar is bitter for your overall metabolic health. And nowadays eating has become emotional and contextual, and we are not eating for survival, we are eating for pleasure, which only human beings are doing. No animals are doing that. So be mindful about what you put in your mouth, how much carbohydrate you put in your mouth, and how much proteins you put in your mouth, and try to balance it. Reduce the carbohydrate, increase the proteins, avoid frequent meals, and don't eat every 2 to 3 hours. And once in a while do some intermittent fasting, maintain the period of no eating time, so that the alimentary tract's metabolism can reset itself. Next thing is your body weight, because people who are obese are having high risk for getting various forms of cancers and arthritic pain and other types of metabolic issues. So lose your body weight by diet as well as exercises. Check your BMI regularly, check your waist to circumference regularly, keep a weighing scale in your home, because if you have a weighing scale at your home, every now and then you measure, and then you will be more conscious about your body weight. 60% of the Indians either having fatty liver disease or having abdominal obesity. Both are dangerous for the organ health, and subsequently that can lead to metabolic syndrome. You will not know your blood values until you measure it. So at least once in 2 years, have a habit of doing a blood checkup. The basic checkup like BP and sugar and lipid profile and your liver function test and kidney function test, basic ECG and echocardiogram are essential to be done if you are above 40 years, especially if you are working as a software engineer and having less physical activity. Even before something strikes you, you come to know that yeah, it's there, so that you can take the remedial actions for that. So I recommend you to have a blood checkup once in every year, or at least once in every 2 years. Lastly, psychosocial and emotional health. Because we are all social beings, we must interact with people, we must have good family, we must have good relationship, we must have good friends, we should go to family gatherings or maybe social gatherings, we must express our feelings. That's how we keep our mental health, because when the mental health is good, you will take steps to maintain your physical health. So try to have a purpose in your life, be useful to others, be relevant to others, try to help others so that you derive happiness out of it. These are the ways by which you can keep your emotional health intact. So in a nutshell, the human's health and well-being is decided upon 3 factors: what you put in your muscles as an exercise, how mobile you are, and what kind of physical activities you are doing is one thing. Secondly, what you put in your gut, the digestive system, what kind of food you are eating, that decides your health. Thirdly, what you put in your mind, your thinking, your attitudes, your belief system, you being nice to yourself and your family members and to others, that will decide your mental and emotional health. So all these 3 things are important for your overall physical health, and then I hope you will be able to achieve that state of painlessness and well-being. I thank you for watching this video. I wish you all happy Physiotherapy Day.